Imagine taking a pill you thought would save your life, only to realize it's a ticking time bomb. Hidden in the shadows of a billion-dollar industry, a silent killer thrives. Counterfeit medicines. From dark, unregulated factories to secret smuggling routes. These fake drugs are made to deceive. Mixed with genuine products and sold to unsuspecting victims of even the first world countries. But how are these counterfeit medicines made? How do they infiltrate the most secured supply chains and end up on your shelf indistinguishable from the real thing? And most importantly, who profits from this deadly business while millions pay the ultimate price? Stay with us as we uncover this billion-dollar business of the most dangerous scam in the world. So keep watching our channel, The Curious Corner. As per the reports of 2022, the global counterfeit medicine market is valued over $432 billion. These figures make pharmaceuticals the #1 illicit activity worldwide. Fake drugs are made and packaged to look like real brand-name medicines, usually having little or none of the actual ingredients they claim to contain. In worst cases, these counterfeit medicines may include harmful substances. According to Interpol, some have been found to contain mercury, arsenic, rat poison, or even cement. Every year, over 1 million people lose their lives due to these medicines, with newborn babies being among the most vulnerable victims. From holograms, barcodes to UV light security features, everything is replicated in such a way that sometimes it's harder even for top-class experts to identify the difference between real and fake. Globally, at least 1 in 10 medicines in low and middle-income countries are falsified, contributing to widespread health risks. Despite the fact that the United States drug supply is among the safest in the world, overdose deaths involving counterfeit prescription drugs have been doubled in recent years. But the real question arises, how is that even possible? Counterfeit drugs for international export are often produced in countries with less stringent regulations and massive demand. India and China are the most famous for it, as they both have the largest pharmaceutical industries in the world and are the major exporters of generic drugs. Despite having strict regulations on paper, the sheer size of their populations and landmass makes it difficult for authorities to trace and eliminate counterfeit drug activities. In many cases, local officials and businessmen of these regions turn a blind eye to these activities or even facilitate them. This may involve providing space for illegal drug producers within larger factories. Drug manufacturers often use hidden laboratories to produce illicit substances for the purpose of producing fake drugs, such as methamphetamine, heroin, and synthetic drugs like ecstasy. The process generally involves the following elements. Number 1. Location selection. Hidden or remote locations are often chosen to avoid detection. These locations might be in rural areas, small towns, or urban spaces that are not easily accessible. The work often takes place during night, in either abandoned factories or in homes that are not under suspicion. Number 2. Equipment. Basic chemical equipment are sourced from major countries illegally. Machines are disassembled and shipped as parts or hidden within shipments of unrelated goods. The nature of the machinery is either misrepresented or genuine businesses help these criminals to import these machines. And finally, number 3. The process of replicating and selling. To replicate drugs like ibuprofen or paracetamol, illicit producers rely on precursor chemicals that are refined in a process mimicking legitimate manufacturing process. Such as heroin is produced from opium poppy, with its active ingredient morphine, which can be chemically altered into heroin in hidden labs. It's the main reason poppy seeds are banned in many countries. Some drugs can be made using chemicals that have legal uses in other industries, such as agriculture or pharmaceuticals, which are diverted and used illegally. Substitutes like chalk, starch, or other inexpensive fillers are used to simulate the appearance and weight of the drug. Even extra chemicals are added to mimic the drug's properties, such as its taste or dissolution rate. The producers also test small batches of the drug to ensure it matches the desired properties, as these are exported to major countries, so the replica must look real to the untrained eye. Experienced and cheap graphic designers are hired to design the trademarks, logos, and pill designs of genuine brands to deceive buyers. Advanced printing techniques are used to replicate the authentic-looking packaging, including brand names, lot numbers, expiration date, and even the precaution slip is replicated. High-quality printers are used to replicate hologram designs with astonishing precision, while advanced laser technology reproduces the intricate holographic effects seen on genuine products. To mimic the 3D or reflective appearances of authentic holograms, counterfeiters layer and laminate materials, often adding reflective particles or glitter to achieve a convincing yet superficial resemblance. Barcodes and QR codes are also cleverly counterfeited to resemble those on genuine packaging. Shockingly, these fake codes often redirect users to fraudulent websites, creating a false sense of authentication. The ultraviolet reactive elements, typically a hallmark of genuine products, are imitated using cheap and less reliable alternatives. Even microtext, watermarks, and other advanced security features are reproduced using specialized printing technologies. Thanks to the availability of skilled, creative, and talented individuals in densely populated regions, where labor is abundant. The finalized product is 99% same to the original, but the ingredients are deadly. Even some healthcare professionals may not be able to recognize these counterfeit medicines. But how do they make their way to bigger countries, specifically the US? Criminals create fake certificates of analysis, regulatory approvals, and shipping documents to make counterfeit drugs appear legitimate. They are either shipped using postal or courier services, avoiding the scrutiny that large shipments may receive, or they are mixed with legitimate products to pass customs inspection unnoticed. As the US Customs must process millions of shipments daily, making it difficult to scrutinize all packages thoroughly, the importation of small quantities of drugs for personal use is not always strictly regulated. And as the serial numbers of each drug is also replicated, it creates a loophole. Once these medicines reach the illicit buyers in the US, They sold these medicines through online pharmacies that appear legitimate but operate outside regulatory frameworks. The US has the most expensive medicines in the globe, costing 306.82% more than the global median, even more than of Germany and Swiss. As unlike many other countries, the US government does not regulate drug prices. Pharmaceutical companies often set prices based on market demand, without any restrictions, leading to consumers looking for cheap alternatives. These online pharmacies not only allows to order drugs without prescription but also offers good discount with home delivery, gaining the attention of public. As these drugs are too close to the original, the consumers often use them. In some cases, even the doctors get confused. In the past few decades, the US has initiated many operations, shutting down more than 8,000 of these online pharmacies, selling counterfeit medicine to unsuspecting consumers. However, these were all the international level crimes done through big criminal organizations with proper networks and high budget. The payment is often transferred via cryptocurrencies, and many top-class agencies are working hard to get rid of them. Counterfeit medicines remain a persistent issue in many other countries, including Pakistan, where the problem is particularly severe. This illicit activity not only threatens public health but also undermines trust in healthcare systems. Alarmingly, reports suggest that some doctors have been directly supplying unverified or counterfeit medicines to patients instead of issuing standard prescriptions. These medications are often not available through conventional pharmacies and can only be obtained through specific doctors, raising serious ethical and safety concerns. Weak regulatory enforcement, corruption, and an informal pharmaceutical supply chain contribute to the proliferation of fake drugs within the country. Latin American, Sub-Saharan, Asian, and Middle Eastern countries are all grappling with the devastating impact of illicit drugs. These counterfeit medicines are no longer just a health hazard, they are silently claiming thousands of lives every year. Tragically, this illegal trade has outpaced many other forms of organized crime because it's incredibly profitable, difficult to trace, and often underregulated. But there's hope, as the world is fighting back. The World Health Organization has introduced global surveillance systems to track and prevent the spread of fake medicines. Interpol's crackdowns have led to the seizure of millions of counterfeit drugs, and innovative technologies like blockchain and digital tracking are transforming medical supply chains, making them safer and more transparent. Yet, the battle is far from over. As consumers, we are on the front lines of this fight. Always buy medicines from trusted sources, check for authenticity, and report any suspicious products to protect not just yourself but countless others. Because every pill counts, every life matters, and the fight against counterfeit medicines is a fight for humanity. Thank you so much for watching. Please like and subscribe our channel, The Curious Corner, for more fascinating content.